Are you struggling to measure the business impact of medical affairs? You are not alone. For nearly 30 years, this question has confounded senior leaders in the industry and different professionals. And today, with all the advancements and evolution in healthcare, technology, and information, the need to find a concrete answer to this question has never been more crucial. Stay with me. In this video, I will provide 7 major recommendations based on real-life experience, what worked and what didn't work. If we do them in a consistent manner, I think medical affairs will find it very easy in a short time how to measure and communicate the business impact. Let's get started. Let me first share with you why I think that this question is needed to be answered today and that this is crucial. As you know, medical affairs has dramatically shifted to be a strategic pillar in the pharmaceutical industry since a few years. And now, with all the changes that we are seeing around us, the evolution of the healthcare systems, the focus on patient centrism, the technology and the information evolution, all these are factors that increased the need for more medical affairs. In other words, it increased the demand to have more medical affairs. More medical affairs in terms of activities, in terms of communication, externally, in terms of generating data and many benefits that the pharmaceutical industry wants to invest more in. That is to say that in our today's world, the need for medical affairs has increased. There is no doubt about this. The point is that this requires a lot of investment. And when you talk to any financial or business professional, if you want to invest, you need to tell me and articulate clearly what you will bring to the table. And what we'll bring to the table for us is the value that we add every day in our work as medical affairs. So are we ready to communicate this value in a way that can be clearly understood by financial and commercial professionals and business leaders? Are we ready to understand what are the determinants of what looks good and what doesn't look good? So this is what we are not, and we were not trained on. We were not in medical affairs trained how to communicate the business impact of our work. I'm not the first one, of course, who is trying to answer this question. In fact, there are a lot of reports and a lot of even studies that tried to help the organizations, the pharmaceutical industry, how to answer this question. In other words, how to measure medical affairs. This question has been asked since almost 30 years, and no one answered it, even those studies and reports. I looked to many studies, many reports, but none of them actually told me something that I didn't know. None of these studies or industry reports defined clear steps that we can do tomorrow so we can communicate the business impact easily later on. So, for example, one study in 2009, they looked and tried to answer the question, how can we measure the function of medical affairs in the pharmaceutical industry? And actually, they ended up measuring the impact of an educational activity or some educational activity. And they said that if you do 1, 2, 3, you will increase the knowledge of the participants by 17%. Okay, that's fine. You are measuring the impact of one educational campaign. But this is far away from measuring the impact of medical affairs on the industry or on patients or on the business. Another reports, and actually this one was published last year, they gave some recommendations and general suggestions on what to focus on in order to be more valuable. So again, I didn't find that this is a clear answer. How can the industry measure the impact of medical affairs? My first recommendation is to master business acumen. Now, if you are working in medical affairs, whether you are a medical science liaison or you are the CMO, you need to understand business from A to Z. Everything in the business environment you are working in. This includes clear and deep understanding of business strategies, market dynamics, and you need to develop a financial literacy that enables you to have a smooth discussion with business partners. The days that medical affairs are only focused on science, these days are gone. And we need now to understand and combine both the scientific acumen and the business acumen. Imagine yourself in a business review or a medical review, and you are asked, what is the market share of this product or that product? And probably you are asked in order to ensure, are you allocating enough resources on this, or you need to spend more time on that? And you don't know. So it may have been accepted years ago, but today's life, today's world, today's environment doesn't accept anymore someone who is working only with science without clear understanding of business. Don't forget, at the end of the day, we are working in business firms. Additionally, and my strong recommendation in this context for medical affairs colleagues, again, if you are a junior colleague or a senior colleague, you need to develop financial literacy. You need to understand how to budget. You need to understand how to allocate and reallocate resources. You need to understand the P&L and how it is calculated. It is a very, very important for medical, especially medical leaders, to know this stuff. And the third point when it comes to business acumen is that we have also to understand and realize that cross-functional collaboration has never been that important. Again, the time that departments work in silos is gone. Now everyone has to work together, whether we are talking about a launch activity or an educational campaign or a patient initiatives. All these initiatives nowadays in the industry must be done in a collaborative manner, and all departments must contribute. Earlier, I gave an example of the omni-channel approach. How can you have 3 versions of an omni-channel plan in one organization? You can't do that. And in order to do a successful omni-channel strategy, you need to align with all the departments involved. At the end of the day, you are targeting one customer. The other important point here is that this cross-functional collaboration should be under the patronage of the alignment with the overall strategy, the overall business strategy. So that was my first recommendation, business acumen for medical affairs. My second recommendation is to learn first and to deploy strategic thinking and planning in everything we do. And for medical affairs leaders, you need to develop clear strategy, clear vision, long-term vision, and clear strategy. And then you need to be ready to be adaptable, flexible enough to adapt this strategy upon any updates in the environment or the resources or whatever factor. So you have to understand business acumen first, and I put it number 1 because of a reason. If you don't understand the business, it is impossible for you to develop a strategic vision. It's impossible for you to develop a strategic plan. Instead, you will be doing sporadic activities or sporadic tactics without hitting the target, and definitely without impacting the business. And you will be in a mess if you are asked now to prove the business impact or to show the business impact. So let's put this equation together. Understanding the business acumen is a must in order to have strategic thinking and strategic vision. Without both of them, you will not be able to demonstrate business impact. And this is a clear equation that we need to understand. The third recommendation is to have clear cutting-edge metrics. Whether you are using quantitative or qualitative metrics, actually you should use both, or strategic or operational metrics, use the metrics. That's the most important thing. And use the metrics, but don't keep your metrics for medical affairs limited to your goals and appraisal discussions. Communicate your metrics. So first, put clear metrics that are related to the business impact you want to achieve. And throughout the year, focus on these metrics to achieve. And not only this, but you need to communicate every step you do or in every action you take, how this contributes to achieving this metric. Believe me, at the end of the day, doesn't matter if you achieved 100% or 80% of it, but you have contributed significantly to that metric. And so you have contributed significantly to the business strategy, and then you can easily demonstrate business impact. So it goes this way. Put clear metrics related to business impact, work on them, communicate your work, not when you achieve, but throughout the way, and then you will be able to demonstrate the business impact, not only at the end, but also in the middle of the way. The next one, or the next recommendation can take days to discuss, but let me start it. It's about communication. We need to upgrade and update, call it whatever you like. We need to update our medical affairs communication strategies. We cannot in 2024 communicate as we used to do 10 years ago or even 5 years ago. Life has completely changed. We are living in a very fast world that communication today means completely different thing than what it meant years ago. You open the YouTube and you cannot tolerate staying 5 minutes on a video. You want to get the essence of it. You open the TV and you cannot follow long series or long movies. You want something fast. So today's communication is completely different than the communication we used to be comfortable doing. In this context, our job in medical affairs is rather difficult because we are communicating usually complex medical knowledge and information. So my recommendations in this: first, avoid jargon. Try to make your communication very simple and very easy, whether it's verbal or written. 2, utilize technology to the maximum within the frame of the local laws and regulations and also your SOPs. 3, bypass any barrier. If the barrier is language or culture, train yourself and learn how to bypass these barriers and reach your audience, whether we are talking about internal or external communication. And oh my God, internal communication today is more difficult than any time, is more difficult than the external one, because now you want to prove business impact. So you have to know your target audience. You have to map your internal audience, and probably you have to personalize the message going to them. We have not only to communicate, we have to ensure that our messages are received and well understood. When it comes to communication about our work, we have to be relevant and we have to focus on the impact. So what we used to do is to be proud of what we have achieved. So if we did an educational program, for example, we used to tell the story of how we did it well, how the customers were happy, how this will improve the knowledge, and so on. But Today, if we are focused on demonstrating business impact, we need to ensure that when our messages relate to similar events, we'll tackle a point that will prove business impact or will show business impact. For example, if you conduct a consistent educational campaign, you need to find the metrics that will say that this has contributed to close the care gap by 2%, or that this has helped screening 100 patients, something like this. But you need to have your metrics very clear when it comes to defining the impact of individual projects. And I will tell you later on a very smart way to avoid this in order to ensure that you are really demonstrating the impact without the need to stay a lot of time thinking about a metric or spend a lot of effort trying to find them one about the impact of one individual initiative or activity. After communication, we have real-world evidence. We are talking about 400% increase of the volume and the utilization of real-world evidence across the world in the last 10 years. So it seems also that there is an incremental increase in the volume of real-world evidence and in the utilization of this volume from year to the other. So every year we are using real-world evidence more. We are generating more than the year before, and so on. So real-world evidence seems to be the future of evidence-based medicine. In fact, real-world evidence today is a cornerstone in the evidence-based pyramid, because if we get results from the clinical trials, these results need to be balanced in the real-world life. And real-world evidence provide a very good balance to the data that we get in the controlled environment. So you have to do real-world evidence. You have to generate real-world evidence. If you are in one of those big organizations, pharmaceutical organizations, this is one of the major pillars that can show the value and demonstrate the business impact of medical affairs. And if you cannot, if there is some sort of limitation that you cannot generate real-world evidence, this is not the end of the road. You can still use real-world evidence generated somewhere else. But real-world evidence is a must and should be an integral part of every medical strategy. You have also to take key opinion leader engagement to the next level. So this is critical. Why? Our colleagues in the commercial field, they visit the customers, and probably every single visit they do is measured by revenues they generate. But we don't generate revenues. And our visits to the customers are focused on science and research. So if we cannot get money, if we cannot bring money to the table, we need to bring impact. How can we do this? We have to revitalize our process for key opinion leader engagements. We have to plan very carefully, map our customers precisely, focused on the business objectives that we need to achieve, again, aligned with the strategic and business acumen. And after planning, we need to be consistent and to develop the art of generating valuable insights. I'm saying it again, developing the art of generating medical insights. Our medical insights should be like a painting that you take time in order to generate. And then, after having these valuable medical insights, you need to communicate. You need to communicate in a way that demonstrates the business impact. And imagine if you are getting one insight every week, one valuable insight every week, well generated and put in the context of a very important business strategy. Who wouldn't be interested to know it? Who wouldn't be interested to listen to it? Who wouldn't be interested to implement it and follow up on it? So it starts from our field medical teams. It starts from our communication with customers and generating meaningful insights. It has a lot of components from all the recommendations that we discussed so far, including communication, strategic thinking, understanding business impact, having the strategic vision focused on what we wanted to achieve. The seventh recommendation, and I think it's also very important, it is to think big. It is to think big. And here I can tell you what I meant earlier when I said I can tell you an easier approach. Thinking big here means don't limit yourself to demonstrating business impact of small initiatives, but rather think collectively. I would communicate the value provided regarding one portfolio, let's say oncology, rather than going into each value proposition of each single type of cancer, or my work in one or two of types of cancers. I would rather communicate the value or the impact on the country level more than an individual key opinion leader. So maybe looking to the bigger picture will make it easier for you to demonstrate and achieve what you want, to make it easier for you to demonstrate the business impact. Think collectively. And here, a lot of discussions with colleagues, managers, and partners in order to focus again on the strategic imperatives and the strategic directions you want to reach. And accordingly, you will find the right platform to communicate the business impact of your medical affairs initiatives. And here also, another important recommendation when we think big about demonstrating the impact, it's about being proactive. So let's say that we want to conduct or to run an advisory board. Don't think of the impact after the advisory board. You need to start thinking of the business impact at the planning stage. Think before doing so, while planning, what do you want to achieve? What impact you will bring out of this advisory board? Maybe during this discussion with yourself, you will decide that, no, I wouldn't do an advisory board and I will do a study instead or something like this. So don't postpone the business impact discussion and thinking after the event. Try to think of the business impact before doing your medical initiatives. Finally, it's all about strategy. Thinking big is about the strategy. Have yourself a specific strategy to demonstrate business impact so you don't miss anything. Start doing your goals one by one and make this aligned with your personal work strategy to demonstrate business impact. So this is what I wanted to share with you, 7 recommendations that I apply them to myself. We need to understand the business acumen very well. We need to learn and deploy strategic thinking and planning. We need to upgrade and update our communication strategy in medical. And we said we cannot communicate today the same way we used to communicate a decade ago or 2 decades ago. Also, we need to utilize one of the most important functions that we have in medical affairs, which is key opinion leader engagement. And we have to use and leverage valuable medical insights. We have also to think big. And I think I missed one. Did I? Yes, I missed real-world evidence. And real-world evidence is a very important initiative that we need to focus and to make it central in our medical strategies. So these are the 7 recommendations. I would like to hear your feedback. I will leave some links to some sessions and articles about the 7 individual recommendations and probably some additional resources. So please check this in the description. I'm sure that being consistent in this approach and following these guidelines, I think that we will be on the right track to demonstrate the medical affairs business impact. Thank you very much and see you soon.